are also tested. So you can see that's the reason why that has gone up. Southern Western, interesting phenomenon in that area, because there's also a tour group. Before they have to leave South Africa, they test, and there's some positive tests. And there was a case of a wedding, also positive cases at the wedding. And again, a warning sign for us, a gathering of any nature potentially is a super spreader event, but that's also been contained. In the rural areas, there are ongoing cases amongst Stellenbosch University students, but it seems to be under control, although the behavior is still a concern in the town. In Garden Route, there's increased numbers in Oudtshoorn and a few other places, but every team and every area seems to be under control, and people are responding accordingly. Overberg and West Coast similarly, and this in West Coast, the phenomenon of potentially looking out for cases that can be connected to the Northern Cape in terms of travel. So our teams are hypervigilant, watching and responding and reporting as these things happen. From wastewater this week, we can again say that the wastewater plant readings this week again show that at 15 treatment plants in the metro, there were no COVID detected. It's better than last week. Zandvliet was higher, but it's also coming down. So it is also a good sign that from the wastewater, there has not been a sustained increase, and it is actually decreasing. In Breda Valley, there were decreases in the Dorens and Toast River, and there were no COVID detected at Worcester treatment plant. Rosenwil has had an increase, but it's still lower than what was in Toast River. Theewaterskloof, all 4 municipalities, has had no COVID now consistently for over a month in terms of the weekly testing. So our message still remains the same. We might have come through Easter, but we are still in the midst of a period of holidays. And these are all potential areas where people will get together. So it's really about vigilance, about watching out for super spreader events and being very, very vigilant and being very rigorous in terms of containing any sign that could trigger a third wave. So we would like to caution against interprovincial travel if it could not be avoided, avoiding gatherings of any big nature, especially when people come from different places, and especially if there's elderly with comorbidities. And if people have to gather, the strong message is it should be small, it should be short, it should be outside, and it should be quiet, not a lot of expressing of let's call it your breath into open space. And social distance, ventilate and mask. And really this is the call that we're going to continue to make. This is the habit we're asking everybody to reconcile with, that it should be second nature and a habit that we do these behaviors to keep us all safe from a third wave. And these are keeping it small, going outdoors, open windows, skip the crowds if at all possible. So our health platform response today, we can gladly also say there's an easing of the pressure, and it's been a sustained easing of the pressure on the hospital platform in terms of hospital cases for COVID, both public and private. The COVID cases is only making up 5% of our beds currently, and places like Brackengate Hospital of Hope currently only has 10 patients with COVID. So our dashboard shows the following. We have 83% occupancy of all our beds across all the areas in public sector, but only 12% occupancy in designated COVID areas. And as I said, 5% of all patients in hospitals currently has COVID. The oxygen use, a very important marker that I indicated previously, we now have a combined usage of 24 tons per day for private and public in this province, and for private sectors, public sector specifically, 13.59 tons per day. We have actually in this week received a plan from AFROX, which is an improvement plan to make sure that they have specifically planned for contingencies should the need arise for increased oxygen use as it happened in the second wave. So to come to the healthcare workers, we now can report to you that currently in the Western Cape, there's only 12 active cases of healthcare workers. And this is against a backdrop in January when we had a case as high as 1,000 healthcare workers being positive in the Department of Health. So these are positive signs. You can see that in March, we had 38 cases only amongst healthcare workers. So far in April, we're starting to go to the middle of April, and we've only had 7 cases so far. And when we look at this spread of the cases, this is for healthcare workers in the Western Cape Department of Health. You can see the phenomenon of the first wave. You can see the phenomenon between the 2 waves, and you can see the phenomenon now after the second wave. And the weekly number of cases, which now starts approximating 1 case per week, 4 cases per week, 1 case per week, 1 case per week, which gives us the sense of so few active cases. And this is the first signs, as I've always said, that the vaccination program are protecting our healthcare workers against contracting COVID. This is our recruitment drive. We've reset our recruitment drive. We can fill up to another 800 posts, and we have proceeded quite well in terms of filling these posts for both a potential third wave, but then for the massive vaccination drive that we're about to embark upon. So then that brings me to the vaccination. If I look at the phase 1 vaccination, that's all supposed to be for healthcare workers. We still anticipate that we will be able to cover more than 60% of healthcare workers with the doses we receive via Sisonke. And we're preparing, therefore, to scale up significantly with the arrival of the commercial Pfizer and Johnson & Johnson doses towards the end of April, the beginning of May. And this is from the original Sisonke. So just to give you a sense, we have received the 36,240 doses. We've got the first tranche of that, but we've not used it because of the pause. So as of the 13th of April, we had 53,507 healthcare workers vaccinated. But we are currently, you would all have noticed and obviously know about this, that given the 6 reported cases of a very rare clotting condition in the United States, and it must be stressed that that's 6 rare clotting events out of 6.6 million vaccinations that has been administered in the United States. The program has temporarily been paused, and it's really to allow the scientists and the regulatory authorities, and that's the FDA and SAPRA, to evaluate all the information and to make a determination about the safety and the continuation of the use of J&J vaccine. We expect this to be a matter of days, as these are all reconciled, and then we expect the pause to be lifted in a matter of days when the safety has been given the green light for our continuation. At present, it must be stressed, there's no clear causal relationship that's been established between these rare events and the Johnson & Johnson vaccine itself. Just to update everybody again, these are the vaccination sites that we are still using with the completion of the Sisonke, but I will come to how we're going to scale this up quite rapidly. Important thing is the electronic vaccine data system. We have learned a lot from how to use it and how to make it more user-friendly at the local level to be able to get everybody processed via it. This is the update of that 53,507 vaccinations to date, and as it's been done across the health facilities from Grootskeur with 13,968 all the way to Caledon with 1,790 and all the other areas in between. Just an update of our vaccinators. We have 4,585 vaccinators in training or has registered for training. 2,511 have completed the training and have been accredited to be able to do vaccination. This is the distribution of that 2,511. You can see them all in all the geographic areas, and you'll see that this becomes quite an important consideration when we talk about the next phase of vaccination, because you can see this training and trained vaccinators is distributed across all the geographic areas in the department. So this brings us to phase 2 for the vaccine implementation, and it's targeted to start in the middle of May. So let me just start off to say that phase 1A, which is the Sisonke trial, has afforded us the opportunity to learn many lessons about governance, how to work with between national, provincial, the districts and local sites. Also about how to set up a vaccine site, the layout, the IT infrastructure, to make sure that you have the right vaccinators and a good flow of work through that site. The information system required, especially this electronic system, and to be able to do appointments and scheduling. We learned a lot about people behavior because we all are quite familiar with vaccine hesitancy in terms of the trust of the people coming forward. But we also saw vaccine envy in this specific instance, in that people wanted to get ahead of somebody else in the queue. So it's very important for us to actually understand the behavior and why it's important to stick to a principled position of fairness and continue to hold onto that position. And then in terms of communication, the ability to communicate in an agile fashion, to minimize the impact of resurgence, build trust and create assurance, and communicating the process becomes very important for individuals, because an individual needs to know how do I know when I can vaccinate, where must I go, what can I expect, and what will be the outcome for myself. We've also learned about meticulous planning, about knowing how many people there are, what is the vaccine allocation, the capacity to process and to run smoothly. We've learned in our deliberations with our colleagues in the private sector, and I really would like to commend our partners in the private sector for the working relationship of us working together as one in terms of serving the population of the Western Cape together. Also about adverse events reporting, and you know that's in the media now, because why it's so important to track every single possible adverse event, and that's been very meticulously tracked by the researchers, Professor Linda Gale Becker, Professor Glenda Gray, for the whole country in terms of Sisonke. We will also have a system coming online in EVDS about the electronic tracking of adverse events as we vaccinate at bigger scale. And then the cold chain and distribution of vaccines, a big issue, but we've learned quite a lot, especially in preparation for the Pfizer vaccine. So what does this mean for the next phase? As the Premier indicated, we will complete the remainder of the healthcare workers firstly, and so that by the 16th of May, the 17th of May, we officially want to kick off the formal part of our big vaccination drive aimed at the general population. So when we say it starts on the 17th of May, what we're saying, if anybody that's over the age of 60 in this province, we will be communicating to everybody over the age of 60 to say from the 17th of May onwards, we would want you to be registered. We will assist you with the registration. We would indicate to you where to go for vaccination, and we will communicate to you what to expect when you get to the vaccination site. And we expect that to be from the 17th of May, till the middle of July. If you're age of 50 years and plus, so between 40 and 50, we expect that from the 16th of July, a similar process will happen with you. If you're 40 years over, from 40 to 50, we expect by the beginning of September, it will come to you. And we expect by the middle of October, towards the end of October, beginning November, we will then do everybody over the age of 18. So we will continue coming back and saying, if you're a member of the public in the Western Cape, and you fall into those age groups, this is what you can expect, and we will continue to communicate in your local neighborhood. Where do you go? What will happen? And how will we actually make sure that you come through it on the other side? We also have done the following then in preparation for that. We now know all the people in the age groups, and over 60, 50 to 59, 40 to 49, 30, and all of those. So as I've just given to you, we know where people are, where they live, where they find themselves, and also where workers are in these age groups. And this is what we can confirm with you now out of the announcements made by Minister Mkhize about the contracts being signed for both Pfizer and J&J, our expected supplies per month for the next 8 to 9 months for the Western Cape. So we then can tell you, this is how many Pfizer doses we're going to get per month. This is how many J&J doses we're going to get per month. And it's spread out all the way till December. You can see that with these supplies that's been, in a sense, guaranteed to us out of the contracts, we can cover more people 6 million as opposed to the 4 million that we have. So that's good. It's a buffer that we already have built in terms of these projected supplies for us in this. That does bring us to our acquisition process in the Western Cape. It's always been designed that if anything goes wrong with the national supply chain of vaccines, we have a backup plan, a system. So we followed a standard supply chain process. We now have more 30 unlisted bids. So it's an ongoing number. Each submission is evaluated. Each entity is engaged. And we then follow through on all of those. The approaches that we've made to suppliers and manufacturers, guided by the SAPRA registration, is to J&J and Pfizer, and they've both said to us that you can see where they were busy with is to conclude those big contracts with the National Department, of which I can now show you what supplies we will be getting over the next 8 months via that process. It may change in future that we can procure directly additional doses from J&J and Pfizer, but for now, they have been working on those supplies for national. The next steps of this team, there's a targeted request for information process with a view that we potentially could acquire additional vaccines by August if anything in the supply chain goes wrong. We've also, the Premier has written to foreign governments that we have relationships with and to explore if there's potential vaccines access via that route. And we have ongoing communication with our private sector colleagues in this regard. There's also a legal opinion that we're currently getting around how to deal with the liability in the no-fault provisions should we directly procure vaccines in this province. And you can understand in the negotiations with Pfizer and with Johnson & Johnson, that was a big issue that had to be looked out for. So that all brings us to the point that we can do this level of detail now. So we can say that from the 17th of May to the 30th of October, which is, I said to you, almost like that first part of phase 2, with the doses we are going to be getting, we are going to be using 26,600 doses per day we have to maintain for that period. And you can see the split between rural and metro, and then in the rural areas, it's broken down per area. So you can see in Central Karoo, we will be doing 88 vaccinations per day during this period for everybody over the age of 60 in that area. But if you compare that...
Let's take you now back to Durban.